Chapter 2, Nursing Process. Define the term nursing process. Describe 7 characteristics of the nursing process. List 5 steps in the nursing process. Identify 4 sources of assessment data. Differentiate between database, focus, and functional assessments. Distinguish between a nursing diagnosis and a collaborative problem. List 3 parts of a nursing diagnostic statement. Describe the rationale for setting priorities. Discuss appropriate circumstances for short and long-term goals. Identify 4 ways to document a plan of care. Describe the information that is documented in a plan of care. Describe and discuss 3 outcomes that result from an evaluation. Identify 2 learning strategies used by educators to help students implement the nursing process. Definition of the nursing process. It's an organized sequence of problem-solving steps. It's used to identify and manage the health problems of clients. Accepted standard for clinical practice by the American Nurses Association, and it is a framework for our nursing care. Characteristics of the nursing process. 1. Within the legal scope of nursing, we have diagnosis and treatment, actual or potential health problems. 2. Based on knowledge, based on critical thinking. 3. It's planned, it's organized and systematic. 4. It's client-centered. 5. It's goal-directed. 6. It's prioritized with the greatest threat first. And 7. It's dynamic, meaning ever-changing and updated. As you can see by this diagram, first is the assessment, collect data and organize data. Second is diagnosis, analyze the data and identify nursing diagnoses and collaborative problems. Planning is next, prioritize the problems, identify measurable outcomes, which are goals, select nursing interventions, document the plan of care, then implementation, which is carrying out the nursing orders, document the nursing care and the client responses, and finally evaluation, monitor client outcomes, and resolve, continue, and revise the current plan for care. Steps of the nursing process. The first step is assessment. This is the first step of the nursing process. It is a systematic collection of facts or data. Types of data collected, objective and subjective. Objective is observable and measurable facts, referred to as signs of a disorder. Subjective data are information only the client feels and can describe, and this is called symptoms. Again, objective data is signs, subjective data are symptoms. Sources of data, the primary source always is the client. Secondary sources include the client's family, reports, or discussions with other healthcare professionals. Is the following statement true or false? Objective data consisting of information that only the client feels and can describe are called symptoms. An example is pain. That's false. Objective data are observable and measurable facts and are referred to as signs of a disorder. Subjective data consists of information that only the client feels and can describe and are called symptoms. Steps of the nursing process continues. Types of assessment. You have a database assessment, which is initial information, the client's physical, emotional, social, and spiritual health, and obtained during admission interview and physical examination. Those 2 are included in the database assessment. Then you have focus assessment, which is information and details about specific problems, expands original database. Also, focus assessment can be repeated frequently or on a scheduled basis. Functional assessment is comprehensive. It's performance of ADLs, cognitive abilities, and social functioning. Which of the following is a primary source for information? Client's family, client, medical records, test results. You're going to choose one. The primary source for information is the client. The client's family, test results, and medical records are secondary sources of information. Diagnosis is the second step of the nursing process. The first one was assessment. Diagnosis is identification of health-related problems. You develop a nursing diagnosis. Health issues that can be prevented, reduced, resolved, or enhanced through independent nursing measures are used to make a nursing diagnosis. Nursing diagnosis groups are problem-focused, risk, syndrome, health promotion, the NANDA list, and from the NANDA list, authoritative organization for developing and approving nursing diagnoses. Steps, again, diagnostic statements. A problem-focused nursing diagnostic statement contains P, the name of the health-related issue or problem as identified in the NANDA 1 list under health issue. E, etiology, its cause, related to. S is signs and symptoms, also called defining characteristics as evidenced by. You can use risk for, syndrome, and health promotion, or readiness for enhanced, whatever it may be. These are used, steps are used to make a diagnostic statement. You can see that nursing and medicine overlap with shared expertise to collaborate on problems. On the left side is the circle for nursing exclusively, which is discipline expertise. This entails screening for high-risk individuals, families, and communities, and teaching, also preventative strategies. Diagnosis and management of complex altered functional responses of individuals, families, and communities, and use of various intervention modalities like counseling, teaching, self-help, non-traditional therapies, and negotiation. And in addition, management of refractive health problems. Discipline expertise on the medicine side is differential diagnosis of complex medical problems, management of refractive acute medical problems, management of multi-system diseases with high morbidity or mortality. Shared expertise in the middle and the center include primary prevention, secondary prevention, tertiary prevention, interview, history and physical assessment, diagnosis of acute and chronic medical problems, use of prescriptions, interventions, and teaching to manage uncomplicated acute and chronic medical problems, and use of consultation when appropriate. For collaborative problems, always think monitoring for complications. When caring for clients with collaborative problems, nurses play a key role in monitoring clients for trends or changes that might indicate the client is developing a complication. Which of the following nursing diagnostic statements is written correctly based on the data and the information in the chapter of Tim B. Fundamentals Nursing Process, Chapter 2? Data. The client eats only bites of the food served. She has lost 15 pounds in the last 3 weeks and currently weighs 130, which is more than 10% underweight for her height. She has been experiencing chronic vomiting after eating for the last 3 weeks and is physically weak. Is your diagnostic statement going to be risk for imbalanced nutrition, less than body requirements related to vomiting, or 2, imbalanced nutrition, less than body requirements related to inadequate intake of food secondary to vomiting, as manifested by caloric intake below daily requirements, recent weight loss of 15 pounds and current weakness? Or is it number 3, weight loss related to vomiting as evidenced by reduced intake of food, or 4, possible malnutrition due to inadequate consumption of nutrients? As you can see from this slide, you should have chosen number 2, imbalanced nutrition, less than body requirements related to, you see that there, and as manifested by or evidenced by, you have caloric intake below daily requirements, and then the recent weight loss and current weakness. That has all the parts that you need. You have a diagnosis, you have related to and evidenced by included. Third step of the nursing process is planning. This is when you set priorities and determine which problems require most immediate attention. Think ABC, airway, breathing, cardiac, circulation. Establishing goals. You need to establish goals that are expected or desired for your outcome. You need short-term goals and long-term goals. So again, this is planning, the third step. This table explains prioritizing nursing diagnoses. Physiologic examples of nursing diagnoses would be imbalanced nutrition, less than body requirements, or ineffective breathing pattern, or pain, or impaired swallowing, or urinary retention. Those are physiologic problems with nursing diagnoses. Safety and security, the human need, you would use risk for injury, impaired verbal communication, disturbed thought processes, anxiety, and fear. Love and belonging needs would include examples of nursing diagnoses such as social isolation, impaired social interactions, interrupted family processes, and parental role conflict. Esteem and self-esteem, human need again is disturbed body image for a nursing diagnosis, powerlessness, caregiver role strain, and ineffective breastfeeding would all be examples. Self-actualization, an example of nursing diagnosis for that would be delayed growth and development and spiritual distress. This part of the nursing diagnosis includes short-term goals and long-term goals and goals for collaborative problems, all again under planning. So short-term goals characteristics need to be measurable, client-centered, realistic, have a target date for accomplishment, a predicted time, and a timeline for evaluation. Long-term goals are desirable outcomes that take weeks or months to accomplish. Goals for collaborative problems are written for the nurse, and the focus is what the nurse will monitor, report, record, or do to promote early detection and treatment. Selecting your nursing intervention. Use planning measures to accomplish identified goals, involves critical thinking. Also, planned interventions must be safe, within the legal scope of nursing practice, and compatible with physician orders. Documenting the plan of care. The plan of care has to be written by hand. It's a standardized form, computer generated in some facilities, and based on an agency's written standards on clinical pathways. Nursing orders are what, when, where, and how, performing nursing interventions and providing specific instructions. Communicating the plan of care. Nurses share the care plan with nursing team members, client, and client's family. It's a permanent part of the client's medical record placed in the client's chart. Nurses refer to it, review it, and revise it. Implementation is the fourth step in the nursing process, carrying out the plan of care. This is implementation of medical orders and nursing orders. Medical records are legal evidence. Again, anything that's charted is legal evidence. Identifying nursing intervention is all going to be in the medical record, and in it will be the quantity and quality of the client response. Evaluation is the fifth and final step of the nursing process. This determines whether the goal has the client has reached the goal, and also to analyze the client's response. Is the following statement true or false? Evaluation is the fifth and final step in the nursing process. This is true. The nurse determines whether a client has reached a goal. The other steps in the nursing process, again, are assessment, diagnosis, planning, and implementation. Use of the nursing process provides a standard for clinical nursing practice. The Nurse Practice Act does hold nurses accountable for demonstrating all the steps in the nursing process, and to do less than that implies negligence. Documenting the plan of care. The Joint Commission, a not-for-profit organization that accredits healthcare organizations in the United States, requires that every client's medical record provides evidence of the planned interventions for meeting the individualized client's needs, but not necessarily a nursing plan of care. Plans of care can be written by hand, standardized, or on printed forms, computer-generated, or based on an agency's written standards or clinical pathways. Some standardized care plans are pre-printed. Both computer-generated and standardized plans provide general suggestions for managing the nursing care of clients with a particular problem. It is up to the nurse to transform the generalized interventions into specific nursing orders and to eliminate whatever is inappropriate or unnecessary. Agency-specific standards for care, policies that indicate which activities will be provided to ensure quality client care, and clinical pathways relieve the nurse from writing time-consuming plans. Both tools help nurses use their time efficiently and ensure consistent client care. Concept mapping, also known as care mapping, is a method of organizing information in graphic or pictorial form. It's created by identifying a main subject with interconnected links to related components. This strategy promotes critical thinking while gathering data from the client and medical record or a written case study, selecting significant information and organizing related concepts on a 1- or 2-page working document. Various formats can be used, as you can see in this picture. Students select a map format using circles or boxes and draw lines or arrows linking relationships within the map. Components within a nursing concept map generally include the client's reasons for seeking healthcare, focus assessments, nursing diagnoses, expected outcomes, nursing interventions, and evaluation of the client's response. Those who use concept mapping report that the technique allows students to integrate previous knowledge with newly gained information, enables students to organize and visualize relationships between their current academic learning and new unique client assessments, increases critical and clinical reasoning skills, enhances retention of knowledge, correlates theory knowledge with nursing practice, helps students recognize information that they must review or learn to promote safe, appropriate client care, promotes better time management for beginning students otherwise focused on the composition requirements of nursing care plans rather than the use of the nursing process itself. Therefore, in the first picture, you can see the spider graphic used in concept maps. This is organized around a central theme at the middle of the map with lines to subtopics. This is easy to read, shows basic facts, but not interrelationships among components. The next picture is hierarchical. This shows information in descending fashion, general to specific, with lines and arrows depicting relationships. This is easy to interpret, simple to more complex. It also shows how information flows from one to another. Systemic or system concept map provides a concept and links components showing their interrelationships. This is very complex and detailed, uses arrows to show relationships. It is time-consuming and most likely to facilitate critical thinking. Concept mapping increases critical thinking and clinical reasoning skills, enhances retention of knowledge, correlates theory with nursing practice, helps students recognize information, and promotes better time management. Here we have some critical thinking exercises from Timby. If you want to answer these, it would be very helpful to you to understand this chapter. Number 1, if an unconscious client is brought to the nursing unit, how can a nurse gather data? Number 2, 3 nursing diagnoses are on a client's plan of care. Ineffective breathing pattern, social isolation, and anxiety. Which has the highest priority and why? And 3, while reviewing a client's plan of care, a nurse notices that the client has made no progress in accomplishing the goal by its projected target date. What actions are appropriate at this time? And number 4, a nurse plans an 1,800 calorie diet to manage an obese client with the nursing diagnosis of obesity, but the client rejects that intervention in lieu of exercising 30 minutes each day. What nursing action is appropriate in this situation? And this is the end of the slideshow.